Good morning, everyone. BC's top health official publicly states that mask laws in other areas of Canada were ineffective in stopping COVID infections. That's very true. This is a tweet from this guy here, and it says, Dr. Henry, quote, "The mask mandate has not made a difference in the transmission of the virus in other jurisdictions." Right, and that's in response to this question. I tracked it down, I found it, and I've queued it up, and okay, here it is. Hold on. Okay, I'm not sure if I'm going to break this up or let her talk. There's two distinct chunks that I want to, this is a terrible pause face. There's two distinct chunks that I want to highlight here, but here's the question that she's responding to when she said that. Here we go.
One of the things, Dr. Henry, we're hearing from businesses on the mask mandate is a concern that, yes, people are hearing your advice, but without requiring it, customers in many cases are being abusive or rude to store managers or people who are working in those settings. So would a mandate not alleviate some of that animosity that is felt in those settings?
Yeah, so there is an order that requires...
Just quick question. The mandatory masks shouldn't be mandated to tamp down on the virus. They should be mandated to tamp down on the abuse that potential shopkeepers have because they're asking people to put on masks and the people are saying, I don't have to wear a mask, I'm not going to wear a mask, thank you very much, have a good day, or whatever they're saying. The motivation of the reporters is kind of betrayed there by the question. We don't want to cut down on the virus, we want to cut down on those rude people, man. Let's mask those rude people up. Weird, right? Notable.
Businesses to have COVID safety plans. And a retail location, for example, should have plans that include mask wearing. And that means making them available to people, making it clear that people need to wear a mask when they're in those settings, making sure that staff know when they need to wear masks in their setting as well. And those are enforceable, as I talked about today, in the same way that every other part of what we do in business. And if we look at Quebec, for example, that is their model as well, and that the onus is on businesses to make sure that masks are available and that people understand the rules within their business. And what I'm saying is, as a community, we need to recognize that those are rules that keep workers safe and keep us safe when we're in those businesses, those restaurants, those retail stores, etc. So we all need to follow those. It doesn't make a difference for me to, we have a number of things that we do of personal behaviors, like cleaning your hands. For me, that is the perspective that we're taking from a provincial level. It's not us, it's not me who can find somebody. That's not what's going to make a difference here. What's going to make a difference is that people know clearly the rules and the situations that they're going into. The other thing that...
Okay, so I'm going to just pause it here, and she's waxed poetic there. That whole thing was basically saying masks work, they need to be worn in stores and restaurants and other places. Mandating it, me finding people is not going to help, but everybody knows these are the rules and these rules should be followed. However, she follows it up with saying that it hasn't cut down on infection in other places. And there's context around that too, but hold on. Before I leave that point, I want to make this point. Here's Tony Heller saying, pointing out in Minnesota, that's where the mask mandate happened and cases increase, right? Here's the same graph again. Here's the United Kingdom, mask mandate, and then cases increase. How do masks work again? Where's the science that talks about how masks work? How masks are effective at stopping the spread of respiratory virus? Outdoor mask mandate and then indoor mask mandate. And so how does this work exactly? The same curve is seen here, right? You can see the testing and, the new case curve, right? Mandatory masks were somewhere in July, I think July 12th in Guelph. And here we're seeing this massive increase. But the deaths just aren't keeping pace, not even close to the first wave. Not even close. It's a shadow of the first wave. And so it's very, very interesting that Dr. Henry has talked about how important masks are and how they should be worn and you should know those are the rules, but I'm not going to mandate that. I'm glad she's not mandating that. That's wonderful. Here is the rest of her talking about this. She says, in other settings, you go.
That is clear, and we look at this across the country, and so not all provinces have a provincial level mandate. In Quebec, it's the onus is on businesses, and they have a fine on businesses. I don't believe that that's appropriate, but what we need to think about is, the mask mandate is not in and of itself something that has made a difference in terms of transmission. Many of the settings that we are talking about are settings where people would not naturally wear a mask, like in your home or at a party. So these are things we have to take into account. We also know that when there's a fine scheme set out, that we know that certain populations are disproportionately targeted, and we've seen that happen in other communities as well. If you remember earlier on in the pandemic.
So fundamentally, she's saying masks work so well in the public, the only transmission we're seeing is at home. So we couldn't possibly mandate masks there, could we? Here's Costco. They're mandating masks everywhere. Doesn't matter about your human rights or the Ontario Human Rights Code. This is how they're going to get around that. It says, for members who are unable to wear a mask or face covering, Costco has delivery options available on Costco.ca. Thank you for understanding and your cooperation. And they're saying if you can't wear a mask, they'll give you a face shield. If you can't wear a face shield, they'll give you a mask. Lucky us. Look at those corporations looking out for our safety and just tossing out our basic human rights. Here is Gay Hawks. She said, so livid, I could spit nails. Costco and their new mandatory masks and face shield policy, medical reasons why I cannot do either. I talked to my local store who said they're following HQ or headquarters, I think, HO, headquarters orders maybe. It's a human rights violation. What would you do? Cancel your membership, file a human rights complaint. And I provided the link to file a human rights complaint. Spoiler alert, I think this is probably their legal cover. Okay, so will something happen? They'll say, we've provided an option for people to shop here who can't wear masks. They can shop on their phone or they can shop from home. Is that good enough? I don't know. Here's the letter from President and CEO of Costco, Craig Jelinek. I think that's how you say that. It says, effective November 16th, we will require all members and guests and employees to wear a face mask or face shield at Costco locations. Entry to Costco will only be granted to those wearing a mask or a face shield. Children under 2 are exempt. Costco has had a face mask policy in effect since May 2020, but members who could not wear a mask due to a medical condition were exempt. This is no longer the case. If a member has a medical condition that prevents them from wearing a mask, they must wear a face shield at Costco. This updated policy may seem inconvenient to some. I think it violates basic Ontario human rights, but anyway. However, we believe the added safety is worth any inconvenience. Now, I'll note when you're filling out a human rights violation, when you're filling out one of these forms here, it can say, did they try to accommodate you? And in this case, you would say yes, and then you have to explain why the accommodation isn't very good. I don't know. Do they sell veggie straws on their website? How much is the delivery cost for veggie straws? Matt Walsh says, the masks work doctrine is unfalsifiable. If cases go down, it proves they work. If cases go up, it proves we need to wear them even more. Literally nothing can be considered evidence against masks, and that should tell you something. And again, I'll point out Tony Heller's mask charts, right? The masks are mandated, and then after that, we see cases rise. However, it's very notable that deaths are not in lockstep with this. And it's also notable, deaths are counted by people who die within 28 days of having a positive COVID test, but the positive COVID test or COVID-19 doesn't have to be the thing that kills them. Just it's enough to just have the positive COVID test be there, and now it's a COVID death, right? It's a COVID-related death. So it doesn't matter if you died of COVID or if you were tested for COVID-19 and then you got in a car accident on the way home. That's COVID death, man. Sorry about your luck. Positive death for COVID. You were tested for COVID and then you died. Done. That's classification. Boom. That's WHO classification as well. Here is the legal Canadian patient rights. You have the legal right to refuse consent to any proposed treatment. A mask is a proposed treatment. A mask is a medical intervention, right? You give or refuse consent for any procedure for any reason. Have a medical professional clearly explain the health problems and treatments to you. Is Costco explaining the potential drawbacks of having a mask on your face for the time that you're in the store? Here's the Law Commission of Ontario that says, the right to refuse unwanted medical treatment is fundamental to a person's dignity and autonomy. This right is equally important in the context of treatment for mental illness. See Fleming versus Reed. mental illness thing doesn't really matter, but it's highlighted, so I read it. But the point is, you have a right to refuse to have a medical treatment, a vaccine, a mask. You have a right to refuse. And they're going to say, sure, now you just can't go to any of the stores. But that's also a violation. I believe that it is a violation. Here's the Human Rights Code. If you have a disability that prevents you from wearing a mask, you should be able to access exemptions from the demand and be able to go into the store. The Section 22 order that the province or the city put out, in fact, even highlights this. A person shall be exempt from wearing a face covering on the premises if the person is a child under 2. B, wearing a face covering would inhibit the person's ability to breathe in any way. C, for any other medical reason, a person cannot safely wear a face covering, such as, but not limited to, respiratory disease, cognitive difficulties, or difficulties in hearing or processing information. Or D, the obligation to provide a reasonable accommodation under the Ontario Human Rights Code requires exemption from this requirement. I just don't know how much more clear it is. And the fact that they're just ignoring it and saying, yeah, you can shop online, like, that's good enough, right? Good enough. Welcome to Costco. Here is 8 months later, says Jenny, will Canadians be denied re-entry if they refuse to download the app? Starting November 21st, travelers entering Canada must submit their travel contact and quarantine information digitally through ArriveCan app or website. Learn more at canada.en.publichealth. Unbelievable. It's unbelievable. It's just like the digital tracking is here and you don't have an opt-out, right? I'm sure you do. You have to call a number. You have to call a number instead of downloading the app. But the creeping, what's the word? Restrictions, communism, all of that is not appropriate. In Guelph, we're in the orange section, right? They say orange, I think, up here somewhere. Yep, orange. But we have less cases in the hospital this week than we did last week. And last week we were in green and then yellow when they changed things. Or 2 weeks ago, maybe we were in green and then yellow. They changed the statistics. They lowered the numbers across the board in our doctatorship. Thank you for people reminding me. It's a doctatorship, and they're trying to even usurp more power. We're going to get to that in a minute. The doctors, they want to make their briefings for Doug Ford public, and I think what they're going to do, by doing that, they're usurping his power, right? He doesn't get to make the final decision. We're doctors, after all. We know what's best for this population, right? Right? Except they're not elected. So, I think maybe the politicians get reelected, et cetera. They should shoulder the blame and all of that, and they should make the decision. They should have people who are informing them, and the public should know who those people are. But I don't know that the doctors should necessarily be giving public updates of what they're telling Doug Ford. And not because at that point the public are just going to demand it, just like they demanded the drawing down of the thresholds. And again, I'll say the numbers do not back up the lockdowns and the necessity for the lockdowns. How many? So 71, and thank you again for the people who were explaining the rolling averages. I appreciate that. I've got a formula now so that I'm going to work on it later today. Things got busy yesterday. But I counted up, I told you guys this yesterday, but I did the 7 days, and of the 7 days, 103 people had died. 71 of those, according to Christine Elliott on the Saturday, were from long-term care or old age homes. So when you've got 70% of people dying from old age homes, and a case is counted by if you die within 28 days of a COVID death, and we're having majority of people who are dying above 70, is this something that we need to destroy our economy over? Is this something that we need to toss out basic human rights over? Is this something that we need to have businesses policing customers over? I don't think that it's appropriate to put businesses in that kind of position. That's in fact highly inappropriate. It is in fact terrifyingly inappropriate. Right? You know that milk scene in Inglourious Bastards where what's his face comes in and the people are hiding under the floor and he's all smiles and he gets milk and everybody knows, can read the undertone. Right? Like, this is a dangerous situation. Everybody watching that knows this is a tense, dangerous situation. And like, there's no questioning about it. The guy getting the milk, like the Nazi colonel, the guy giving the milk, the farm owner, the people under the floorboards, they know. They all know what's going to happen here. And we're hurtling into this, right? And like, the inaction is just the people who know sitting inactive, doing nothing. But what what could we possibly do? What could people, like, you could go on a street corner and have a sign and scream and yell. You could be Frank Vaughn and scream at the camera and talk about how you have to wear a mask because it's the only thing that's going to protect you. You could incite fear, and you could, scream and talk about it a whole bunch. I don't know how to fight all of this, right? There's no good way. I don't get it, because they've got the media, and they've got a lot of people who believe that these numbers, who can look at these numbers and go along with these lockdowns. Oh, I guess businesses will survive. I guess the government will take care of us. Like, I don't know if it's complicity or infantilization. They're being children about this, or they've been told that it's all okay and we're taking care of it, and they believe them. I don't know what it is. I don't know why people are so willing to believe that the government is not, that the government is going to help you endlessly and just print money endlessly until what? But when you look at the false tests, the PCR tests are resulting in false positives. And here's a New York Times article: PCR false positives, pseudo epidemics exist. We've got one. When in a pseudo epidemic, everyone thinks it's a real epidemic, but we don't have extra deaths. That's howling out for an explanation, and there is only one. It's literally not a single person interested. And yeah, like, again, here's the deaths mapped compared to the 2017 to 2020 across February, March, April, May, June, July, and August. And I don't know why I don't have September, October. We're in November. I should be able to access them, but they weren't on the chart. But the source is here. You can check. This is from the Canadian government, and it doesn't seem to matter. It doesn't seem to matter that the deaths aren't marching up. Right? The cases are going like crazy, but the deaths are, pretty negligible. And when you put in the context of how the deaths are calculated, it's a wild ride to consider what people are willing to give up in order to be compliant. Okay, and here's a chart of coercion versus COVID-19. On the left is chart of coercion, on the right is COVID-19. I'm not going to go through this, but communist coercive methods for eliciting individual compliance. A lot of it matches up. It's scary, because if you know what you're looking at, you're under the floorboards going, at what point does this all break wide open? At what point is it better to run than stay here and play this game, right? I really don't know. And that's how I feel. That's how tense I feel this whole thing is. And we're going to get into the US stuff. We're going to get into a whole bunch of that stuff right now. But here's another one. Greg Toland says, are Ford Nation ready to admit that they're lying about case numbers based on fraudulent PCR tests and claiming we're in the midst of an epidemic? Because last week in court in Portugal found that these tests were worthless. Current CT in Ontario is 38 to 45. And I've been talking about this. It says, if someone is testing PCR as positive with a threshold of 35 or higher is used, as is the rule in most laboratories in Europe and the US, the probability that the said person is infected is less than 3%, and the probability that the said result is a false positive is 97%. Worthless. Less than flipping a coin. Do you have a cold, or is it something else? Read it for yourself. Ontario has been lying from day one about a fake pandemic powered by fraudulent case counts based on a PCR test that cannot tell who is infected or infectious. Thus, all data is worthless. This is a massive fraud. The deaths, like I said, are if you have a positive fraudulent test in the last 28 days and you die with the fraudulent positive test, then you count in those case numbers. How are they making the deaths? That's how they make the deaths. How are they making the case numbers? That's how they make the case numbers. This is a fraud. Here's Doug Ford. It says, Ford to make announcement from Queen's Park Tuesday afternoon. The cases are going up through the roof, everybody. Don't look at those death counts or the ICU counts or the hospitalization counts, but the case counts. They're going up through the roof. Here it is. Anyway, Premier Doug Ford will be making an announcement from Queen's Park Tuesday afternoon. Ford will be joined by Health Minister Christine Elliott, Michael Tibulo, sorry if I got that wrong, Associate Minister of Mental Health and Addictions, and Solicitor General Sylvia Jones. Oh, is the lawyer there to say, yes, they can do this, be quiet and go into your house? Back to this. The announcement comes after Ford dodged questions about publicizing advice he and his cabinet received from provincial COVID-19 advisory tables on Monday. Now, the other side of this could be true. I was saying that they're trying to usurp power. They could overstep, maybe, and have the public not go along with them, but and then thereby ruin their credibility. But it seems like so far, Dr. Tam and the other Dr. Haydu, oh my goodness, talk about misspeaking. Miss Haydu, who's not a doctor and is our health minister, have zero credibility as far as I'm concerned. Like, absolutely no credibility. They got masks wrong according to current dogma, which is in my belief, incorrect. They got borders wrong. Now they said, don't wear masks. Now we've got mandatory masks. Borders, virus doesn't see borders. Now we've got mandatory closed borders with the United States. I wonder why that is, right? So will they ruin their credibility? It seems like nothing ruins your credibility in Canada, right? Oh, did you lie to everybody and give your family a bunch of money and kick back to we through... give money to your family through kickbacks to we? Bill Morneau? Justin Trudeau? Oh, never mind. I guess you guys win a big majority and we're all going to ignore those election results from down south. No, we're not. And we're going to talk about that. Sorry. I'm getting sidetracked today. I'm a little scattered. I apologize. Back to this. On Monday, Toronto's medical officer of health, Dr. Eileen de Villa, revealed that Toronto public health staff had to sign non-disclosure agreements to participate in talks held with the province health measures table. During a Toronto Board of Health meeting on Monday, the board voted unanimously to ask the Ford government to make COVID-19 advice from the advisory tables public. Last week, the Ford government faced criticism after CTV News Toronto obtained confidential provincial documents which suggested that thresholds for the higher categories in its tiered framework for COVID-19 restrictions were raised significantly as coronavirus cases continued to increase. Cases. It's nothing but cases. Nothing but cases. It's air. Fiction, right? Fiction, because the PCR test is fiction. In the opening press conference that I was watching that I showed you with Dr. Henry, she was talking about how the healthcare people can't run at this rate for very much longer, and the world is crazy, and we can't keep asking this of our healthcare professionals, et cetera, et cetera. And Anthony Furey says, he says, here's a story from 2016 about how multiple Ontario hospitals were operating at over 100% capacity, and we did not shut down broader society because of it. And yeah, I'm not going to go through this, but it's absolutely the norm for a hospital to run at 110% in Ontario. And I'm not saying that that's better, but shutting down surgeries in order to kowtow to an artificial and imposed by government threshold of 85% occupancy or 85% capacity or whatever it is, to maintain, surgery has to stop in Guelph, right? Because we're at 88.7, status yellow. Oh no, right? 88.7. But it used to be that we would operate, and it's funny because it's not better. This doesn't fix the problem. It gets rid of the problem. It's like busing homeless people from Toronto out to other communities because, they've got more money and they can help them out there, right? Yeah, it gets rid of the problem. Magic. Just redistributes it, right? Here's an interesting idea. The CDC claims that smoking is directly responsible for 480,000 yearly deaths, including 25,000 from secondhand smoke. Wow, that's a lot of deaths. Hey, man, could you imagine if that amount of deaths were stacking up in your local hospital? It's not, but imagine if it was. They never forced anyone to stop smoking to save a life. Then why are you being forced to wear a mask? All they did actually was tax cigarettes more. How much is a case of smokes now, or a carton of cigarettes? A pack and then a carton. How much is that? That's a lot of money now, right? I remember when cigarettes were $9. I used to spend $9 on a top brand pack of cigarettes. I smoked Belmonts. Yep. But I haven't smoked for 10 years now, which is good. But Linwood, okay, moving into other people, and Linwood is part of the Trump legal team. And he represented Nick Sandman against the media and got him a good settlement. I heard from Amazon. I thought it was $250 million, but I don't think it was that much. But Linwood responds to this one. This tweet says, this is a communist coup. My family dealt with this crap for 50 years in Poland. Communists are liars, thieves, and murderers. This fraud to steal America is the hill we must win on or die on now. Every other issue is crap. Get in the fight and save America or it's gone. Linwood says, bingo, truth. Face it, we have not yet begun to fight. Prepare, be ready, pray. And very interesting, right? And this plays into the next story. Tucker Carlson showed this video, and I think that I showed this yesterday, where Justin Trudeau vomits up the globalist word salad, right? He's signaling all of those globalist words, build back better and all of that stuff into this 30-second little speech to the UN. This is cut together. It's from a longer speech. But Tucker Carlson absolutely pillories him for it and takes him to task, saying that they're using COVID-19 as an excuse to implement the Great Reset. And our premier has been asked about this. Do you agree with Justin Trudeau that this is an opportunity to build back better. This is Belinda Cariolis, I believe, who said this. And they wouldn't say no. They wouldn't say no. So they're using this as an opportunity to push political change that otherwise would never be allowed. That otherwise we would say this is soundly rejected. We reject your Build Back Better. We reject Build Back Stronger, Aaron O'Toole. We reject the new normal, and we demand politicians to work to return us back to the old normal. No masks, no social distancing, the ability to live our lives and plan things. Here's Bill Tuss. He says, has anyone seen a politician or major personality speak about Trudeau's Great Reset? Tucker Carlson. I'll show you another one. Here's Annemie Paul. She's on the Build Back Better train too. She says, just held a press conference to discuss the chance in a lifetime we have to move to a green recovery. It's time for Canada to lead on the climate and get to net zero emissions while creating the jobs of the future. Canadian Greens have a plan to get us there. So it's the same type of rhetoric, right? Like the green recovery is the same as Build Back Better. Here's Maxime Bernier, and he weighs in on this. He says the pandemic has provided an opportunity for a reset, reimagine economic systems that actually address global challenges. Investing more in international development. Open your eyes. Globalism is not a conspiracy theory. It is happening. It's happening right now. Yes, it is. Here's an interesting thing. City of Calgary and the city of Edmonton were found on the server Silt or Still. That's terrible. I should find out how to say that word. But that server, that infamous server, not Hillary Clinton's, the other one. In Germany, they got taken down this week. City of Calgary and the city of Edmonton are customers of SIL. So you know what that means, right? So potentially, well, what does that mean? Now, this is a 10-minute video, and I smiled from ear to ear listening to this video. I listened to this video while I was doing dishes yesterday, and I think it came out yesterday. This is. I'll let her introduce herself. She's a lawyer, and she gives 10 minutes talking about what Donald Trump did in 2018 and what the implications of that are. And I'm just going to let us listen to it 1 minute because I'm long today, I think. Yeah, I'm long.
Human rights attorney Lee Dundas here. I want to talk to you today a little bit about a recent declaration of a national emergency by President Trump to deal with the threat of interference in U.S. elections and how this intersects Trump's legal team's statements in the last 48 hours on the election irregularities, if you will, and what this all means taken as a whole. So recently, Donald Trump issued an executive order that I was actually not familiar with, entitled Imposing Certain Sanctions in the Event of Foreign Interference in a United States Election. In that order, he noted that people had the ability to interfere in or undermine public confidence in United States elections. These are direct quotes. This ability included, and I quote again, the unauthorized accessing of election and campaign infrastructure, which was defined to include information and communications technology, as well as systems used by or on behalf of the federal government or a state or local government in managing the election process, which specifically, if you look at the definitions of what this all sort of devolves down to, includes, and I quote again, voter registration databases, voting machines, voting tabulation equipment, and equipment for the secure transmission of election results. Trump.
The whole video, so worth it. Go watch the rest of this video. It lays it out in a way that just makes you think that if these companies are partnered with these cities, isn't it really notable that in very, very conservative Calgary, we've got some NDP lefty holdouts? Really? Do you think so? Or do you think maybe there's something going on? I think maybe there's something going on. So in light of all that voter election interesting tabulation, etc., the House of Commons adopts a unanimous motion to congratulate Joe Biden and Kamala Harris. Motion calls for both to be invited to Parliament and to request Biden to make an address. Biden's last known trip to Canada was as VP in December 2016. The last known trip to Canada? What are you saying, CBC? Was he secretly coming to Canada? Was Hunter Biden in Canada? Probably not. I don't think. Maybe. Who knows? I don't know. I don't know if Hunter Biden was in Canada. Here's France. But I didn't expect it to be a unanimous motion, right? Like everybody in the Canadian government, every single one, right? How many people were selling these Dominion machines and to whom? Right? Oh, so if you're telling me if I sell this to my district that I'll be definitely winning for the foreseeable future, great. Where do I sign? Right? The whole unanimous motion. Hey, every single one of them. Pierre Poilievre wasn't like, there's still some time to wait on this, I'm going to vote no? Were you whipped? Was everybody whipped to vote yes, right? Did Justin Trudeau say, you know what, this is one of those things that I'd like to have a united front on, everyone? Here's Francois Philippe Champagne, and he's the foreign minister, I believe. And he said, I was very pleased to welcome PM Trudeau, Justin Trudeau, at the Global Conference for Media Freedom. He reiterated Canada's commitment to defending freedom of the press. Canada will always stand up for a free press, the cornerstone of our democracy. Somehow I just don't believe him, right? Like there's some reason to think that he's not telling the truth, and I can't. Here it is. I had to go down and open more comments to find this one. I saw this one yesterday right after he posted it. It says, didn't your government have to be taken to court and lost to allow journalists you didn't approve of being allowed in the press gallery during last year's election campaign? Yes, specifically during the debate. They didn't want the Rebel and True North and Andrew Lawton, specifically, I think, to cover the public debate, like the one that was going to be broadcast nationwide. Yeah, you can't do that. We always support a free press, except for those guys who are racist. Because, that works with everybody. Just paint them with the racist brush. Here's CTV News, national news, saying the Canadian military says it's making plans to play a role in the eventual rollout of COVID-19 vaccines nationwide. You have a right to refuse any unwanted medical treatment. You have a right to refuse any unwanted medical treatment for any reason. And you don't have to explain yourself. Any proposed treatment, anyone, you have a right. You have that right. Very, very strange. Why would the military be involved? I know why. Okay. Hey, there's Marwan Tabari. He's back at work, right? He's waiting for that next court date. Here's Marian Monsef, and she says, how much do I make now? Like $250?
Miss Wilson Raybould.
The question they're going to ask me, how much do I make now? Like $250?
I'm sorry, Miss Raybould. I want to remind.
Please don't forget to mute your microphone when you're making asinine comments. Oh, and here's the leader of the NDP doing question period from his car. We're so professional here in Canada, right? Pros. Justin's buying some guillotines. Guillotines? I don't know why. I really don't know why. He's got very large sausages to cut. I don't know. Why would you want programmable hydraulic guillotines? Isn't that? Maybe we're just going, get to ramming speed, right? We're going full speed ahead to communism. We need guillotines. I thought this was interesting. Niagara Falls Review. This is November 16. Oh, and here's an ad for the review. China-based light show to fill Niagara Falls Park this December. And it says, in the works since March, the owners of the China-based show have been working closely with all three levels of government and public health officials to make it happen. Yeah, the show sprung from a 2017 trip to China financed by a local company, Canada BW, meant to develop partnerships between Canada and China. Morocco, a city councillor at the time, took part in the trip while representing her tourism business destination, Niagara. Man, have you guys heard of what BYG is? I've talked about this before, but I wanted to show you. This is one of the only videos that I could find about BYG. But basically, the BYG plan it's a carrot and stick plan. They being the CCP, invite you to an event or something like that. They provide women and alcohol, and then you get yourself into a sticky situation, which they take advantage of. And then probably they pay you money too. Like, hey, hear about these voting machines? If you talk to this guy, you'll get a good deal on those voting machines, and you'll probably be guaranteed to win elections for a long time. And then when they push you to do certain things that you don't want to do anymore, that's when they pull out the pictures and say, hey, yeah, remember when you did this? You probably won't want these published in your local newspaper. But the reality is the newspaper would never publish them because they're an asset now, right? They're not working for us anymore, right? So that's BYG. That's the BYG plan. But isn't it interesting, right? I wonder how the business destination Niagara is doing these days. I wonder, right? Are they suffering from COVID-19 fatigue? Suffering any losses? Or are they doing just fine? I don't know. Very interesting, right? Very interesting world. I'm almost done. These are kind of supplemental tabs that didn't really fit into the rest of the show. This is election fraud stuff. This is more from Trump's legal team. He says if you want to find out about the truth, then watch and share this video, and it talks about election fraud. I haven't actually watched the video yet, so check it out. It's just the fact that Trump's lawyer is sharing it, or Trump's election team lawyer is sharing it, is interesting. Global News is reporting on the RCMP guy who was found spying for China. Remember that BYG thing I was telling you about? He was a PhD. But anyway, he's now awaiting trial for security breaches. 3 of his former staff are suing the government for harassment. And an independent review commissioned by the RCMP has cited senior police officials responsible for the NICC for a clear failure in leadership. So, yeah, that's not going so well. And Quebec is giving $6.7 billion to subsidize electric vehicles, and that's what that's their climate change plan. That's the whole climate change plan. You know what we're gonna do? We're gonna buy Teslas. Done. Next problem. That's it. That's all you need to do, right? Solved. And did you hear Teslas drive themselves? Perfect for when you're driving to the casino. You know, if you're Marwan, or not Marwan Tabar, Raj Grewal, right? I guess he's not a Quebec MP. Maybe he was. No, he was Thornhill, or he was just around here. Okay, that's enough out of me. But there's so much going on. There's so, like, I talk a lot about how, like, I like to look at the news. I like to find out, you know, to find the source for quotes like this. Like, how is the BC health officer saying that masks don't work in certain districts? And that, yeah, they don't work. That's true. I agree with her. But then you find the context out, and that's interesting, right? Like, it's a very interesting situation. But fundamentally, there are so many things happening simultaneously that anybody who's even trying to pay attention wouldn't be able to meaningfully pay attention. And even if you were trying to fight it,
I don't know all of them.
I don't know why this is okay. Even if you were trying to fight it,
and we'll continue
I can't find my mouse now too.
You know, if we are going to make this change, it will be a thoughtful change that will be done ahead of time in discussion.
Just decided to play. If you were trying to fight it, you couldn't possibly fight all of the things at once, right? Like, you couldn't possibly fight all the things at once. The only thing that you could possibly do is choose one thing and try and fight that thing. And that's going to take you a long time. Just, if you want to know how long, just look at my conversation with the Upper Grand District School Board. That took months and months and months. And where did I get? Nowhere. And I'm not trying to say, like, it's hopeless, but man, without something big coming from, without something big, I don't know how we change course. I don't know how we change course even with something big. Because the leadership, I mean, unanimous. Good job, Joe Biden, right? Good job, everyone. We won. Yay. Forget about those sketchy vote counting and all that other stuff. Forget about all that. We won. The world's a better place because Orange Man bad. Okay, that's enough out of me. Thanks for watching, everybody. Check out CanadaPoly.com, check out CanadaReport.co, check out SpeakingMoistly.co, and have a wonderful, wonderful day. Oh, I'm recording with Greg today, so there'll be a Speaking Moistly up later on today. All right, have a wonderful, wonderful day.